other hit-and-run victims. This is Abigail Jones, 2 years old. GCS 9, blunt head trauma with lacerations. IO line in the left leg. Abigail's gonna be okay.
Where's the father?
En route. Other ambo was trying to get an airway when we rolled away from the scene. They were in the crosswalk. They had the signal. Car plowed right through them. Let's transfer on my count. 1, 2, 3. Abigail? Abigail? So I'm responsive. I need to intubate. Broslo tape.
And a chest x-ray?
Push about 12 to 14 kilos. Yellow drawer. 4 of etomidate, 20 of sucks. BP 100/70, heart rate 136, SATs 88.
X-rays in place. Nat, tell us when.
All right, I'm in. Go.
Clear. Right side's whited out. Chest tube.
Ultrasound. SATs down to 80.
Tube's in.
SATs coming back up, 100%. BP and heart rate stabilizing as well.
Pupils are reactive, but sluggish.
Heads up, paramedics are coming in with the father right now.
You go take him. I'll finish this.
Mark Jones, 32. GCS 3, intubated in the field. Suspect a C-spine injury. There's a step off in the back of his neck.
All right, let's transfer him. 1, 2, 3. Thank you, Caesar.
Yep.
Good breath sounds bilaterally.
BP 88/58, heart rate 120. Should we start a neo bag?
Yes, titrate to a pressure 110. Need a chest x-ray and an ultrasound.
Yeah. Oh my God. Dr. Halstead?
Hold on.
How's the little girl?
Vitals are stable, no long bone fractures, but CT head shows diffuse intraparenchymal bleeding.
And what did Neuro say?
I just got off the phone with them. They put in a pressure monitor, and they agreed with me to treat with hyperventilation and mannitol to reduce the intracranial pressure.
Oh, what about the father?
Intubated but unresponsive without sedation.
So, brain injury?
I'm not sure. Pupils are equal and reactive, so that's a good sign. We're just waiting on scan results to see how bad the injuries are. Look, Mark's stable now, but what if he goes downhill? He's wearing a lot of ink. Is this do not resuscitate a legit advance directive?
The hospital's got a team of lawyers trying to figure that out.
Well, what about his family? Do they know if he meant it or not?
We're looking for them, too. It seems it's just Mr. Jones and his daughter Abigail in the world.
He had on a wedding ring. There's no wife?
There was Melinda. Legal found an obituary. She died last year, ovarian cancer.
If his wife had to be intubated and wasn't able to get off the vent, seeing her like that could be why he got that tattoo.
Yeah, maybe that's what he was feeling then, but what about now? He's all Abigail has. I can't see him not wanting us to do everything in our power to keep him alive for her.
Well, the truth is we don't know why Mr. Jones got the tattoo or how he feels about it now, so let's not jump to conclusions until we have real facts.
And in the meantime?
While the hospital does their due diligence, err on the side of life.
Thank you.
Cushing's reflex.
Her intracranial pressure is worsening. She needs more hyperventilation. Get her off the vent. Heart rate still dropping. 47. 2 milligrams of atropine. It's in.
Come on. Come on.
Heart rate's coming back up. 49. 51.
Come on. Come on. Come on, Abigail.
Natalie.
I just need a moment.
Yeah, of course.
What happened?
Suddenly went into V-fib, shocked him multiple times, and he went asystolic. Another round of epi.
It's in.
Check her pulse.
Nothing.
Come on, Mark. Don't you give up.
Pulse is back. Sinus tack.
He's back.
Prep him to move. I'll call ICU. Tell him we're sending him up for cooling.
How long was he asystole?
Almost 10 minutes. What's your boyfriend thinking? This guy's not waking up.
So, I looked at the paramedics' report from the accident scene. Mark was down at least 5 minutes before help arrived. And after this last code, it was almost 10. I mean, that's almost 15 minutes with no oxygen.
I know. Increases the chances the brain function he had is now compromised. Well, we won't know if that's the case until he wakes up.
You think you really will? After he coded?
I don't know.
Maybe it's time to start thinking about honoring his advance directive.
Advance directive, Nat. It is a tattoo, not a legal document.
It might be a proxy to one. And what if Mark does have the paperwork to back it up? I mean, it could be at home in a file or in a safety deposit box.
If something binding exists, the hospital's lawyers will find it, and I'll obey whatever it says. But until then, it's just a tattoo and one of many.
Well, Abigail's organs are still healthy, but they won't be viable for long. Without Mark or any family to consent, we can't donate them. But if we honor his tattoo and we let him go, then the hospital can petition to become Abigail's legal guardian, and we can make the decision to donate her organs before they go to waste.
Natalie, you are asking me to let Mark die. I can't do that.
Well, if by some miracle he does wake up, it'll be to brain damage, paralysis, and the loss of his daughter. So please, help me understand why you won't even consider this.
I have a responsibility to my patients to do everything I can to save their lives. Anything less, then I am failing them.
Okay.
Dr. Halstead, could I have a moment?
Of course.
An emergency ethics committee was formed to evaluate Mark Jones's current condition and future prognosis.
Wait, was formed? Who asked for that?
Between his spinal cord injury and his high probability for irreparable brain damage, committee concluded with reasonable medical certainty that he has no quality of life.
No.
Listen, the hospital will honor Mr. Jones's tattoo as an advance directive. If he codes again, you will not resuscitate.
I cannot just walk away.
I'm sorry, but it's over, Dr. Halstead.
Time of death, 1922.
There. He's gone. You won.